You are watching the DocTalk show.
In our future story today,
I started getting pain like that kind of pricking pain in my stomach. I used not to eat in time. Then I'll eat like at midday, and yet I was a breastfeeding mother. I would have my first meal at around midday. Then one time in the night, as I was sleeping, I felt a certain urge to throw up just out of the blue. I did not know what was happening to me, but I felt a lot of pain and gas in my stomach. So I just decided I need to see a doctor. This could be ulcers. At least let me be sure. If they're not ulcers, let me know what exactly is wrong with me. I saw my doctor, who advised me to do an H. pylori test. So when I had this test from the lab, it turned out to be positive. So my doctor explained to me that, you see, you have ulcers, and asked me since when I had started experiencing the symptoms. So I told him I had them like for the past like 4 to 6 weeks. So he told me he prescribed medicine. So I took this medicine for, I think, 2 weeks, if I can remember very well, about 2 weeks. And the healing process didn't happen immediately, but after 1 month, I stopped experiencing this pain up to now. Then he told me to try and eat in time, and to stop like eat in time and make sure I don't stop breastfeeding my child. Since I was breastfeeding, I had to keep eating, and up to now I've never actually gotten any episodes of such kind of pain. I can actually even fast for a whole day and I don't even get any pain. So I think such diseases, when people really get to know about them in time, it saves them a lot. Seeing a doctor is the way to go in case you get such symptoms like unexplained pain. Those sharp pains in your stomach could be due to something, and the only way you can know is by seeing an experienced medical officer.
You are watching the DocTalk show.
Welcome back. We are understanding ulcers, a very common disease that so many people have heard about. So many people talk about it. They say, I have ulcers, I have ulcers. But do they really know what causes ulcers? This is why we're here today with our senior doctor who specializes in the field of diseases that affect the digestive system. And ulcers are a very common disease that she commonly encounters. So, Dr. Betty, before we went off for the break, we learned that the infection, that H. pylori, is the biggest cause of ulcers, and closely followed by the use of drugs like the painkillers, the diclofenac, the brufen. So those two are the biggest causes of ulcers. Could there be any other causes that might result in ulcers, in getting wounds in the stomach?
Yes, there are others. Cancers can cause ulcers. You can have cancers which are wounds in the stomach. Then you also have other things like excessive alcohol use, like smoking, excessive stress, like if someone gets a very bad illness, not the daily stress of
Not
living,
the daily
yes,
stress
not
of
the
they
not
have
the
no
stress,
money and they
not
have
the
no
acceptable stress of everyday life. But these factors don't cause ulcers alone. Usually they will cause ulcers in combination with something else. For
Okay.
example, if you have H. pylori and you're smoking and you're taking alcohol, then you're more prone to getting ulcers than
Okay.
someone who has H. pylori without these other
ulcers.
factors.
So
So the risk factors in combination make it worse than one alone.
So it isn't that everyone with this infection will get ulcers?
No.
Okay.
The infection is actually so common, up to 70 to 80% of the population has H. pylori, but only about 11% will have ulcers. So that means that not everyone with this infection gets ulcers. And because we've looked at other causes of ulcers, it also means that someone can have ulcers without necessarily having the infection with H. pylori. The other factors, alcohol, smoking, excessive stress, and the rest, may make you have bloating, feelings that are similar to symptoms of ulcers without necessarily causing wounds in your stomach. So if someone gets drunk, gets intoxicated with alcohol, the next morning they may actually get bloating, they may vomit, they may have abdominal pain, which are actually symptoms that one may have when they have ulcers.
Okay.
But it does not necessarily mean this person who is vomiting and having pain has wounds inside.
Okay.
Yes.
So talking about the signs and symptoms, so you mentioned vomiting.
Yes.
Is it so common?
The commonest symptom is actually pain in the upper abdomen.
Okay.
Yes. So pain is the commonest symptom, but we also know that there is a group of people who may have ulcers without pain, especially the older people. So that is why most times they will continue taking their pain medicine for arthritis without necessarily knowing they're developing ulcers.
The wounds are forming.
Only to present when they have complications already. Okay. So the older people may not necessarily have pain with ulcers, but by and large, pain is the commonest symptom.
Pain is the most common.
Yes.
Is it the pain that people call the heartburn? Are they the same?
Yes, it may be heartburn, pain, that burning pain in the upper abdomen, and someone may feel as if this pain is going up to the back, it's radiating to the back. Sometimes they just have fullness. After a meal, they feel bloated, full, they may belch, and then some people will vomit. And of course, if complications set in, then you'll have things like blood loss, vomiting blood.
Okay, so vomiting blood is another another way one can tell they have ulcers. But the most common symptom, as you said, is the pain. The pain up here in the upper part of the stomach. It may be a sharp pain, it may be a burning pain. But the pain usually, how is its relationship with food? Because there's a way some people say the pain it comes when you're hungry is ulcers. Some get it after they have eaten.
Yes.
What is the difference?
So the timing of the pain does not really help much. People feel pain differently. Others will feel pain when they are hungry. Others will feel pain when they are full. So it may also be related to the site of the ulcers, whether the ulcers are in the stomach or in the duodenum.
Okay.
Yes.
But either way,
they will be
still pain.
Yes.
So it can be a very serious disease. Can it cause? Is there any need to worry? Can it cause serious complications?
Yes. So for the majority of people with ulcers, it will cause discomfort. It will cause pain. It will make their life difficult. But in most cases, they will not get complications. Okay. But you will have a small group of people that can go on to develop bleeding. For example, if this ulcer eats into a blood vessel, then they can vomit a lot of blood. They can have massive vomiting of blood that can actually lead to shock, and that is life-threatening.
Okay.
Yes. Another complication is if the ulcer actually eats through the wall of the stomach and causes a hole through. That is called a perforation. Yes. So the acid and the food within the stomach can leak into the rest of the abdomen. You can also have complications of blockage of the outlet. The part of the stomach that opens into the intestines can be blocked by either a swelling around the ulcer, or this ulcer could actually heal with a lot of scars around it, and that narrows the outlet of the stomach.
Okay, so this person, yes. Does it mean the food we eat will not?
So that means the food won't pass. The patient eats will not pass into the intestines. So the food stays in the stomach, and eventually this person brings it back, vomits it
So
And
they
will
have like persistent
vomiting with weight loss, because effectively the food they are eating is not
cannot
useful.
reach the intestines where it's supposed to be
absorbed.
absorbed.
Yes.
So this they call that condition in medicine the gastric outlet obstruction. So it can be a very big complication of ulcers due to a blockage of the part where food is supposed to come out of the stomach into the intestines.
Yes.
Okay, imagine the digestive system is a tube. Okay, it has different organs. So if part of this tube is blocked and food cannot pass through, that's what they call the gastric outlet obstruction. It's really a very miserable complication, just like the perforations or the bleedings. So someone effectively cannot eat food, so they're always losing weight. But I believe there are treatments to counter that.
Yes, so if there is obstruction, if it is only because there is an ulcer, a new ulcer with swelling around it, once you treat the ulcer, the swelling can go down,
Okay.
and then the way opens up.
Oh, okay.
But if it is a scar that has formed, then surgery would have to be done to open that outlet, yes.
Okay, and let's not forget the cancers, the stomach cancers also can cause this obstruction.
Yeah.
So,
So if someone has cancers, usually they are older, like 50 years and more, but we've increasingly seen younger people coming in with cancers. So it's not enough to say if you're young, it's just an innocent usual ulcer. It's better to confirm. So the ones with cancers will tend to have persistent symptoms despite treatment. So if you've treated someone with ulcers for months and they still have symptoms, it's better to maybe refer to someone who can do more tests for them to confirm. And in most cases, they will also come with weight loss associated with the pain.
okay.
Yes.
So I think after the break, because we're about to go for the break, so shall come back to understand a bit more about the cancers. Which people should have this screening for cancers, because it can be mistaken. People think they have ulcers, they're treating ulcers. It's actually a cancer which is growing, and most times these cancers, when it reaches the advanced stages, it's usually very late. You can't do much. So we'll talk a bit more about peptic ulcers, and in particular a bit about the cancer. So send in your questions, your comments on the social media platforms, on Twitter, on Facebook, log on to our YouTube pages, and we're always very happy to hear from you. Our doctors respond to each and every question that you have.
You are watching the DocTalk Show.